Hi everybody. Today I'm going to talk to you about an analysis I did on age, obesity, and diabetes in Connecticut compared to the United States. First of all, what is the association between age, obesity, and people in Connecticut who have type 2 diabetes when you do compare it to the United States? Based on two different databases which I have looked at, we're going to explore this in more detail. Why is this so important? Well, first of all, diabetes contributes to the number one leader of death in the United States, heart disease and vascular disease. It also can be controlled by obesity. And where does age fall into this? So I thought it was important to explore these three variables. First of all, as you can see, the percentage of diabetes in the United States is highest in the 65 and older population. It's slightly less in the 75 and older. Also, that it is on the rise in all categories except for 18 to 44. So maybe that's a good indication of the future trend, I hope. The percentage of diabetes in Connecticut is on the rise. From 2013 until now, it has gone up dramatically. The data sets which I have used to help analyze this data is the Behavioral Risk Factor Surveillance System data set from the CDC. It's current. It's a reputable government agency which uses the BRFSS and is the largest continuously conducted health survey system in the world. Its convenient form offers interpretation, classification, storage, retrieval, and is continuously updated. It's user-friendly, easy to access with an explanation of the data and how it was collected. Another data set which I looked at, which I used for the United States data, was the data from the World Health Organization, the NCD Risk Factor Collaboration data set. This database is a collaboration of a network of scientists from all over the world who provide rigorous and timely data on major risk factors for non-communicable diseases worldwide. It is comprehensive and it uses more than one method for data collection. It's important that I have all of you stakeholder groups in the room today. These are the 7 categories in which all of you represent. We have your advisory groups, your multidisciplinary, that includes representatives from patients, the CDC, BRFS, Obesity Medical Association, World Health Organization. I have some funders in the room from the Health and Human Services, National Institutes of Health. I have grant writers in here. We have researchers from UConn, National Institute of Health, statisticians, college students. We have the IRB represented in here, the Institutional Review Board. We have legislators, we have people in here from the Department of Public Health, state senators, federal, state, and local governments. I see some patients in here, which I have invited today to get your take on this information. We have clinicians, we have doctors, nurses, nurse practitioners, physical therapists, dietitians, pharmacists. We have representatives from the American Diabetes Association and the American Association of Diabetic Educators, and we have the healthcare system represented from Connecticut Hospital Association. Connecticut hospitals are represented here, and health clinics. Now, having all of you here, you're probably like, okay, what do we do? Well, you all integrate somehow. If you look at this influence diagram, you can see that everybody is somehow influenced, persuaded, or supporting another group. So if we start with the researchers, we can see they get support from the legislators and they persuade the legislators. The patients may influence the legislators. The patients also get education from the clinicians. They might give some data to the clinicians. They may also get support from the researchers. They get support and educated from the researchers, and they also get educated from the healthcare systems. The researchers are also supporting and educating the healthcare systems. They're getting influence from the healthcare systems. They're getting influence from the clinicians. They're getting support from the funders. They're also persuading the funders. The funders are supporting the advisory groups, but those advisory groups are influencing and persuading the funders. So as you can see, everybody is either influencing, supporting, educating, or providing some sort of data for another focus group. Infographics are a great way to educate the general public. Also, just to get your information out there with a website on it might actually get some people involved and interested in what you're talking about. It is also known as an information graphic. Information is presented logically. It's like telling a story. It uses data in the form of visuals, text, graphs, and pictures. They say you can remember 6.5 times more information when it is learned from an infographic versus just reading words. What they say is a picture is worth 1,000 words. So this is an example of an infographic that I have devised looking at the association between age, obesity, and people who have diabetes in Connecticut compared with the United States. I have broken it into 3 slides so you can see it more clearly. Type 2 diabetes is a major public health issue. The data from the CDC and the WHO is used to compare Connecticut to the United States. Diabetes is caused by insulin resistance, in which the body cannot use insulin properly. It's the 7th leading cause of death in the United States. 95% of diabetics have the type 2 type. 9.8% of Connecticut adults have diabetes. And 26.9% of Connecticut adults have obesity. Type 2 diabetes can increase the risk of heart disease, which is the leading cause of death in the United States and Connecticut. 47% of adults are educated about diabetes, and yet 83,000 people don't even know they have it. 30.8% is the obesity rate for adults in the 45 to 64 age category in Connecticut. This is expensive. It costs millions of dollars. $194 million have been billed to Connecticut hospitals for diabetes care, including amputations and which is the loss of limbs. The number 1 modifiable risk factor to prevent diabetes is obesity. Obesity is on the rise in Connecticut, leading to more diabetes, heart disease, strokes, and loss of limbs. The percentage of obesity by age group in Connecticut in adults with diabetes gave me some interesting results. I didn't quite expect these results. As you can see in the blue line, 18 to 64% of Connecticut people with diabetes are also obese. This is higher than the 65 and older population. An adult in the 18 to 64 age range is more apt to be obese and diabetic. This contributes to the number 1 killer in the United States, heart and vascular disease. It is important to find out if you are one of the 83,000 people in Connecticut who is diabetic and does not know it. It may save your life or limb. Now, I thought it was important to discuss some ways that we can all get this information out there. First of all, I think it would be good for all of us to break into smaller focus groups to discuss amongst our own group how we can get the information out there. I think we should share this information through infographics. Maybe each one of our focus groups can come out with a different one. We need to share and re-share this information on social media. We need to encourage conversations at the physician's office, the coffee shop, senior centers, fitness centers, hairdressers, wherever we're going to talk about that we might be newly diagnosed, or boy, I just read this article, anything that anywhere that we can get this information out, we need to. We need to educate the insurers, the legislators, people of all age groups. It's important to get screened. It's important to start a conversation. In summary, I have used reputable data sets. Approximately 9.8% of Connecticut adults have diabetes. This is about 268,000 people. 26.9% of Connecticut adults have obesity, which is up 16% from year 2000. Connecticut ranks 34th in the United States for diabetes and 42nd in the United States for obesity. The highest diabetes rate in Connecticut is in the 65 age range at 20.4%. 43.6% of people 65 plus have diabetes and obesity in Connecticut. And yet 57.3%, which is much higher, in the 18 to 64 age group have diabetes and obesity in Connecticut. Why is there this decreased amount of obesity in the 65 plus population? Well, some sources say this may be due to education and adherence to lifestyle changes which they have applied in that younger age group. And now you're seeing the changes in the older age group. Or some oral hypoglycemic agents, some medication and exercise, and lifestyle changes also making a difference, and then their weight is actually less, or is it done just enough to put them in the not obese range? And it's also important to engage all stakeholders and use of infographics to help with dissemination of the information. I'm counting on you stakeholders to help out in this. Thank you very much for your time, and good luck disseminating information. These are my references.